This is Rumble, and I'm Michael Moore, and my special guest today is Dr. Zeke Emanuel. Dr. Emanuel was the chair of the Department of Bioethics at the National Institutes of Health from 1997 to 2011. I'm sure many of you remember that he was instrumental in us getting what is called the Obamacare Act passed, the Affordable Care Act. And was deeply involved with President Obama in trying to, for really the first time, to have it possible that every American could be covered and not have to worry about going to the doctor. Currently, Dr. Emanuel is the vice provost of global initiatives at the University of Pennsylvania. And lately, you've probably seen him a lot on TV. He's the co-host of the Endeavor podcast called Making the Call. He has now, I think once a week, I think it's on Friday nights, he has been on either with Ali Velshi or Lawrence O'Donnell on a series called Life During the Time of the Coronavirus. And instead of having to talk in sound bites or whatever, we get a full hour as to what we're all going through. This has been so helpful. Dr. Emanuel also co-edited the new book, The $1 Trillion Revolution, How the Affordable Care Act Transformed Politics, Law, and Healthcare in America. Dr. Emanuel, Zeke, welcome to my podcast.
Great to be here. Thank you, Michael, for having me.
I saw you on Wolf Blitzer, actually, on the MSNBC's competing network at the very beginning of this. And I talked about this on my podcast, and Wolf asked you a question. The question everybody, I'm sure, asks you every day: how long is this going to last? When's this going to be over? You know, we want this over with now. And I'm in day 60 of my own self-imposed quarantine in my apartment. So I want out like everybody else. But when he asked you that question, I believe this was maybe end of February, might have been the beginning of March. And you said, just very nonchalantly to him, but very direct, very with a doctor's voice, when he said, how long is this going to last? And you said, well, I believe this could be a 2-year pandemic. Those were your words, a 2-year pandemic. Wolf, who is usually a fairly sedate person, goes, what? It was like, are you kidding me?
Yeah.
And you then answered it, and I'm going to let you answer it here for the people listening to this, but I have to say, man, he went right off from you to the other person, never came back to the fact that you had just said, this could possibly last for 2 years. And you tried to explain that it's going to be in waves. It doesn't mean we're in prison for 2 years necessarily. But well, I just want to start there because he never came back to you. I would like you to explain, because you were the first person, as far as I was concerned, and I was watching a lot of the news channels then, who just came out and said the uncomfortable, inconvenient truth. And it turned my head around, and it didn't depress me. I didn't think, oh, all hope is lost. I started thinking, oh, that's okay. Now somebody has said what we're dealing with. Now we can start to figure out how to deal with it. So I turn it over to you to explain what you meant when you shocked at least me, if not the rest of everybody who was watching CNN that day, when you said this could possibly be a 2-year pandemic.
Well, there are only 2 ways of getting out of a situation where you have a very infectious and potentially lethal virus. One is you get enough herd immunity in the community and the country so that the R0, however many people it gets spread to, goes down below 1, which means that the virus basically dies out and you don't get spread of that virus. That'll require 60, 70, 80% of the population to have been immune to the virus. That's going to take time. Now we're, call it 2.5 months into COVID-19, maybe 3 months into COVID-19. And even on the best estimates, we have maybe 10 million people, 12 million people in America infected. That is 3% of the population. That's far from 70, 80, 90% of the population. And so it'll take us a long time to get that kind of herd immunity. The other kind of herd immunity you can get is if you have a vaccine, and then you can distribute it to 60, 70, 80% of the population. And then if you play out how long it's going to take us to get a vaccine, you're out in somewhere fall 2021. And that's, as everyone who comments on this, who's responsible and comments on this says, if everything goes perfectly. And the last time everything went perfectly in drug development, vaccine development was never. There's
Never.
always some hitch that comes up,
Sure.
something unexpected. You test it out in a few hundred people and maybe you get to a few thousand people and something unexpected happens. So if you just, we have rushed it. We're already in humans. So
God bless them. Wow.
yeah, I mean, so we're out there, and we're testing what's called phase 1. That's the safety testing. Now, what's interesting is that some of these vaccines that we've put into people already haven't even been put into animals. Now, that's on the hypothesis that they're very safe, and they probably are very safe. But then you've got to test them, and you've got to give the body a chance to react and see if there are any side effects. That doesn't happen overnight. Then you have to look at that data and make sure that we're protecting people, see if there's anything serious comes up. Then you have to have enough to distribute to people, and the tests, the number of tests needed for an evaluation of whether this is effective at preventing COVID-19. I've 8 to 20,000 people. Well, that's going to take time to enroll them. And then you have to wait for them to develop antibodies and see if they're protected from getting an infection from COVID. So they need to be exposed to COVID. And that's going to take time. So, even if we ramp up production of this vaccine, not knowing whether it's going to work on the promise that it's going to work, we're still talking sometime in 2021 when we're going to have enough data to know whether this thing works well enough to distribute it to people and has a good enough safety profile. Now, you're not going to immediately have 300 million doses or 330 million doses for everyone in the population.
Right.
That's going to take time. And I've talked to officials at like Johnson & Johnson, and they think by the end of 2021, could have 1 billion doses. You have to manufacture them, you have to distribute them, and you have to administer them into people. And again, none of that happens overnight. It all takes time, which is why I think we're talking about at the earliest, if everything goes perfectly, fall 2021, more likely, early 2022. But that's the timeline. And it's very hard to compress that timeline much further than we've compressed it.
And that's if everything goes right.
Exactly.
Which you said doesn't happen. So, I mean, this is why I really wanted to talk to you, because I know you, and I know that you are a truth teller, and you're the doctor everybody wants to have that kind of doctor. Just give me the truth. Don't sugarcoat it. Don't try to, if I cry, I cry, but I'm better off with knowledge than sending me home with hope. I don't want hope. I want to know, what can I do to live? You've just given me some bad news. What am I going to do to live? And I just, when we talk about this vaccine and you say like, this has never happened in this kind of speed and in this fashion, I ask, how's the vaccine for malaria coming? How's the that's what I've been working on that for 70 years. My dad had dengue fever in World War II. He's in the South Pacific with the Marines. How's the vaccine for that coming? How's the vaccine coming for, just go down the list of, HIV, we don't have a vaccine. Now we have treatment, and fortunately less people have died now as a result of that, thank God. But we don't have a vaccine for that. We don't have a vaccine for the common cold. How many years have doctors and scientists been trying to just stop the common cold? It doesn't exist. So I just think that I don't believe in giving people false hope. I believe in realistic hope, but not promising something that we cannot absolutely guarantee. Well, not only, it doesn't have to be absolutely, but that we can reasonably guarantee that we're going to have this vaccine, and everybody's waiting for this. And the discussion I want to have with people is, well, what if that doesn't happen? What if this, like malaria that we've never been able to come up with a vaccine for, what are we going to do? What is the plan? And we need more of you and more people like you just saying things, not the things that we want to hear. I mean, I don't know. I don't. Maybe your wife after you're on a broadcast or whatever says to you, Zeke, you could have tamped it down a little bit. You could have
Well, look. I think part of the problem is you have to give people a structure and a planning. If it's going to be hard, they need to know it's hard. I analogize this to sitting on an airplane. What do I want the pilot to tell me? We're going to be moving in a minute, and then 30 minutes later, we're not moving. No, I feel pissed off at that. On the other hand, if the pilot tells me, we've got this situation, it's probably going to be 20 minutes. I'll get back to you in 20 minutes and update you with what's happening. That's what you want to hear. And that allows you to plan your life. It allows you to make clear. It allows you to make certain, in the case of COVID, demands on the politicians as to how to help you, how to help businesses through this. And so I think that's what people really want. And this idea that, hydroxychloroquine, it's going to cure it, or the summer's coming, it's just going to magically disappear. I think that's quite difficult for people because first they know it's not true, and then it's hard to figure out what is true. I can't trust this person that they keep telling me stuff that doesn't seem quite right. So I do think that there's a value in understanding the timelines and being able to plan, or all of us to plan for it. It also gives us an understanding, well, what can we do between now and then to get parts of the economy going? How much risks are we going to be willing to take in this period of time when we don't have a vaccine?
Most of this weekend, most of the country, not all, but most of the country is going to be partially reopened, as they put it. This has got to drive you crazy on some level, right? I mean, aren't you? I mean, that because it seems from what I've listened to you, what you have said is if we could turn the clock back, which we can't, but if we could turn it back, if we could pretend we're New Zealand, and if we immediately had done two things, a mandatory stay at home and tell the people right away that the government is going to guarantee your paycheck for these X number of months so that we can somehow slow this thing down. We can't do that now. So what is it that isn't it enough? I guess I think the nervousness, the anxiety you even hear in my voice is because if Dr. Fauci and you and Barack Obama and throw in a few Dr. Redlener, just create your team of heroes or whatever. If you guys were actually running the show, if you were making the decisions, you might not always be right. You might make mistakes, but I think all of us would just feel better. And then we could handle the truth. If you tell us it's a 2-year pandemic or it's this or that or whatever. Okay. Well, then let's figure out how we're going to live and not see our country crash, not go crazy ourselves in between these four walls. But we don't have that. We don't have that.
I agree.
We can't get it till next January.
I agree. And I think, look, all the experts say we need more testing. We need more contact tracing. Those are things we need, and we need to work on it. We're going at breakneck speed on a vaccine, and that's really important too. We've got to put in place the kind of regulatory framework we need to get it approved and distributed, and produced and distributed. But I do think that there are many things we can do. I mean, as you said, it does drive me a little nuts that we have places opening up. Georgia is obviously the textbook example of how not to do it. The cases are still going up. Even the president's pandemic preparedness plan for how to open up said you got to have 14 days of decreasing number of cases. I think that's too liberal a standard. But even by that standard, Georgia is wrong. And then Georgia opens up all these activities that require intimate personal contact, cutting your hair, going to the beauty salon, tattoos, which make no sense. They're not essential services, and they're things that we could probably do without. So you got to understand better, and we need a better plan for getting things started. We can start things. We should understand that mortality is heavily concentrated in nursing homes, among the elderly and among people with serious comorbid conditions, whether it's diabetes or hypertension or obesity. And we need to do special protections for those people. And then, there are other things where we can, assuming some risks, not totally, this isn't going to be zero risk, assuming some risk, we can do better at opening things up. And I think that's the direction we need to begin pushing. And I just don't see that planning and that structure systematically happening across all states. Instead, we get, the CDC has these plans on how to, these decision trees about how to open up the economy, and they get quashed instead of released.
If you were president of the United States right now and you had the powers, not given to the governors, but the power federally to declare when we reopen, partially reopen, or whatever, what would you do? Or if you were not the president, what would you advise a president who would listen to you and not to the manufacturers of Clorox?
Well, first of all, we do need to, the testing system has gotten better, but we need to get it really well so people can get a test, make sure the spit test works, ramp it up, and then make sure that we can test as many people as we need, get a clear testing regime so that we have people who are at the front line interacting with a lot of people like grocery workers, healthcare workers, nursing home workers, that they're protected. We need to get the serology test, we've allowed 150 different serology tests out there, but only 12 of which have been certified by the FDA. That's like the Wild West. You don't know whether the serology test you got actually says whether you have an antibody or not. And so it's not very informative. It's really not helpful. That's not a good process to have.
Is there a way to find out if you have had it in the past? Is there a way to find that out?
That's what these serology tests are. If you develop antibodies, the problem is that only 12 of those tests have been certified. The other, 138, they're not.
And it doesn't guarantee, let's say you test positive that you've had it, it doesn't guarantee that you have immunity or that you won't get it again or that you can't be infected again.
Well, I would say it doesn't guarantee. We don't know. This is an area of uncertainty. We haven't done the studies to be able to evaluate that question. Most of us think you're likely to have immunity if you have the antibodies. How long it lasts is another uncertainty. But that still needs to be validated and verified.
So how do you answer people? Like, after Wolf Blitzer sort of turned away from you, after he shunned you when you said it was a 2-year pandemic, I mean, you were 2 feet from him. What was the look on his face when you said that? I mean, I could just see it on the TV, but it being right there.
Well, when we cut to a commercial, he says, "You just made news." It's like, I wasn't trying to make news. I was trying to inform your audience.
No, I know you said it in the way that you would say it's 72 and sunny out. It was not, you weren't trying to shock anybody. He asked you an honest question. You gave him an honest answer. And I'm wondering now 2.5 months later, is that your same answer? Is it a 3-year pandemic possibly? And what does that mean in terms of, are we going to get the waves we thought we'd get if we all social distance correctly, which now we're not going to do that as much anymore? So what is this now? Is it going to be waves, or is it going to be one long 2-year, we're in trouble sort of thing?
Well, so there are some people, Lori Garrett is one of them, who's very, very knowledgeable about this. She thinks it's going to be 36 months, and she may be right.
That's 3 years.
Yes. I don't know how we last 3 years, to be perfectly honest. But I think, what are the likely scenarios? Well, one likely scenario is we have repeated waves, all about the same height. It comes, it goes, it comes, it goes, because we open up and there's a reservoir of coronaviruses that resurfaces. Definitely a possibility. Another possibility, which is actually a little more horrific and one that we clearly want to avoid, is we had a big wave here. It goes down in the summer, maybe because of some combination of, some decrease because of the heat and humidity and who knows. But then it comes roaring back in the fall, and you have a second peak that is higher and worse than the first peak. Now, For those of you who are sort of scratching your head, how could anything be worse than what we've had now? And let me just remind you, 1918, 1919, 1920, there were 4 peaks to the influenza pandemic at that time. And the second peak was far and away the highest, at least doubling the first peak. And it came, yes, in the following fall. So that, I think, is probably, if you're an epidemiologist and a historian, that's what makes you really nervous, that we haven't even gotten to the worst of it. The worst of it is coming this coming fall. And that, I think, makes me very, very nervous. The third possibility is this is the worst. We're going to have echoes, as it were, of ever decreasing peaks until we get a vaccine. And maybe we'll have 2 peaks, maybe we'll have 3 peaks, depending on when that vaccine gets out. But they'll be decreasing and the pain will be less. I think those are the 3 most probable scenarios. But this thing has been surprising from the start. And none of those are easy.
Okay. So, but where let's say you're the doctor. I'm in the room with you. I've come into the examination room. Now I need some I need your bedside care, your best bedside care for me. I'm the American public, and I have been locked in the apartment with the kids now for 2 months. And now you're telling me it could be a lot longer than that. Now the kids aren't really getting an education. And we who care about the people who are cleaning the streets, driving the buses, stocking the shelves, all those workers. I mean, we love the doctors and the nurses, and we hate hearing that how many of them have died. It's just awful. But all the other workers that we wouldn't be eating, we wouldn't have water in our tap in the kitchen if people weren't at the utility plant. All this stuff that has to keep going. Do you see where people go with this? You start to think, what doctor? So I ask you as Dr. Emanuel, I don't want false hope, but I want the truth. And because I think once we get the truth, collectively as a society, we can figure out what we need to do. We know the 8 weeks that were lost there with Trump. We'd all wish that we had those back. Now what? We can't go back. We can't turn the clock back. And he was all bent out of shape when he found out 2 of his staff there had the virus, and all of a sudden now, what I heard on the news, all the staff in the White House are going to be tested on a daily basis, which is what all of us would like. In that sense, if we had something at home where we could just swab our mouth and see that we're okay for another day. Because see, the thing is, after you take the test, am I right on this? If I go to the walk-in clinic down the street, I heard they had tests down there. As soon as I walk out of and they find out it's negative. I walk out of there though. As soon as I touch a doorknob, as soon as I walk by somebody on the street who coughs, I can't say 2 days later that I'm negative, can I? I'm negative. No. I'm negative in that moment. And a lot of times you don't get the results right away. You got to wait a day or 2. So by that time, I have touched too many doorknobs. I have run into too many people. And it's like, what does the test even mean at that point?
Yeah, I think so. First of all, you're absolutely right. The test does mean at that moment you're negative and you could get it the next moment. We should also be a little clear that the data is emerging, that there seems to be a way of getting it. Touching a doorknob is, I won't say you can't get it that way, but probably not the main way most of us who might end up getting it, get it. Being stuck in a car seems to be important. Being in the same house and interacting with people over time seems to be important. And the third thing is going to a family event, a party or something where you're with other people for 2, 3, 4 hours. That seems to be important. If you're outside and you're 6 feet apart from people, unlikely to get it. Just touching a counter or surface, it's not like you can't get it there, but it's not the main way of transmission. So transmission is sharing air with someone for a fair amount of time, like in a car. That's how this thing gets transmitted. You'll remember, Michael, that the famous case of that New Rochelle a
Yeah.
lawyer who was driven by someone,
Yes.
and that other person ended up, because he was driving him to the hospital or to get the test, ended up getting infected. That's a likely scenario. Being with someone in your house, entertaining them in close quarters, breathing the same air over 3-4 hours, that's another way of getting it. So that it's important for people to keep that in mind. But I think,
Can
Michael,
I stop
again,
Clorox wiping my tangerines? Can I do it? Do I have to? I'm not. I don't even eat the skin. Why am I Cloroxing the tangerine?
Yeah, I don't do that, so I'm not sure why anyone does that. I would say the following. We do need to open up the economy. We need to think about how we're going to open up the economy. We need to recognize that it's not just one thing we do, right? There are different kinds of businesses, different abilities to socially distance. So if you think of restaurants, we're coming up to spring and summer. If we serve people outdoors, if tables are spaced 6 feet apart, if the customer actually goes up and picks their meal up off, that's a way that you could safely open restaurants. Another thing to think about is you can't get workers back to work in a serious way unless you get their kids in school. So we'd have to think about, how do we open up schools? Fortunately, we're not trailblazing here. We can look at some places in Germany. Denmark is another place that has done it. So you can see, they bring kids in staggered times. They have them wash every hour on the hour. They have them play and eat only in certain groups so that they're not creating big mixing. They have an opt-out policy. So parents who think that's too risky opt out, because you might have grandma living at home. You might have someone who's got diabetes or serious hypertension living at home. And if the kid got COVID and brought it home, that would be a serious health threat to those people. So we need to be prepared. And you start with the youngest kids. They seem both less susceptible and have less complications if they get it. And online learning sucks for them. So you got to focus. You got to think about this in a strategic way and use all the information we have to open up as safely as possible.
The Chinese, the study that was done after their large bout with it, showed that nearly 70% of those who died contracted the virus from a family member or somebody who was living in the house.
Yep.
And is that right? So they started not sending people home when they tested positive, but to these designated hotels or dorms or whatever, so that they would not infect, especially the older people who were living at home.
Yeah, it would be a good use of hotels that are sitting idle. And yes, we need to think about that. Absolutely.
Can I just ask you more? We only have a few minutes left here because you have to get over to MSNBC. You're not going over there. They're going to beam you there. But I just want to ask you maybe a more global question. And I also want to say, I spoke to you years ago when you were developing the Obamacare and all the important work that was done with that. And maybe if you come back on another time, I'd like to on my podcast, imagine life post-pandemic, so that we start to think a little bit about the vision we have for the way we want to live. And a lot of us do not want to go back to what we call the old normal. Yes, we want to go back to the normal where kids are in school and we can work and all that stuff. But I think we've had a lot of time to think about the way we were living. And I would love to talk to you about your new ideas about where we take the Affordable Care Act and how we improve it, how we expand it, how all those things that I think have to be done. And you're a great thinker with this sort of thing, and I'd love your input into that. So if we could do that another time. But
absolutely. But I think, Michael, a short answer there is, I don't think coming out of COVID, people are going to put up with the patchwork system we have where 10% of the population doesn't have health insurance. I think people are like, this is a serious issue. My health depends upon someone else's being able to be healthy, and their willingness to get health care because it's not going to bankrupt them. We need to create a structure where this thing works for all of us. I don't think Bernie Sanders' Medicare for All is going to be that, because I think it's just too politically fraught. But we can think about, and Joe Biden has said about lowering the Medicare eligibility age. You could think about Medicaid for a lot of people. You could think about a structure where we take parts of Medicare called Medicare Advantage, where the private insurers run the system and people opt for that, which is now extremely popular, expanding that to everyone. This is a fraught moment. A lot of people are losing their job. Therefore, they're losing their health insurance, their employer-sponsored health insurance. it's a moment where I think
Yeah.
the public is going to demand we've got to switch off this system.
Yes.
Let's do a better system
We can do it
where
better. Yeah.
where we have a true safety net. It's not porous. Lots of people don't fall through. We don't have 10% uninsured and call that a victory. So I do think that in the first part of the 2020s, we're going to get some major change. And I think this idea that, Trump just came out, let's get rid of the ACA. Let's have the courts overturn it. I mean, how can you do that when we need coverage at this very moment? It's just incoherent.
And when you say 10%, I just want to put a number on that. 10% of Americans who don't have or are not covered, that's 30 million Americans.
Yeah. And we're still at 30 million.
Yes. And so when you're not covered, when you start to feel sick, you don't go to the doctor because you can't afford it. There's the copays, the deduct, all this stuff. But also we have 11 million wonderful
immigrants
people who are living in this country. They don't have documents and they are scared shitless to go to the hospital or the doctor for the fact, worried that they would be arrested and removed. So when they get sick and they are afraid to get and seek help because of our system that's set up against them, they then not only hurt their families, the people around them, the people they love. I say this to like Republicans, out of your own self-interest. Okay, you don't love immigrants. I wish you were different, but you know what? Out of your own selfish interest, you want anybody who's feeling symptoms to go seek help. That's for you, to protect you. Forget about them. Just protect you. You should support that. And but we can have this conversation another time because I think we can do this. I think we can do it better. And I think that having our health insurance tied to our job, which sounds good. And if you have a good job and you got a good union, especially, you've got great benefits. But we've now learned as soon as the job ends, boom, the government may be giving you some unemployment insurance now. They're not giving you anything for your health care. And it has caused such consternation. But my last question I wanted to ask you was more of a global question. And maybe you're not qualified to answer this, but you must have thought about it. That it seems like this virus, which we don't know everything about yet, possibly happened because the habitat of certain species has been so encroached upon that we have altered the natural world. We've done that in the first world, obviously. It's done in the third world. And in this case, are we ever going to have the conversation? Maybe it has to be after we're through this. I'd like to have it now. That if we don't treat this planet differently, that Mother Nature loves us, but if it senses that we are doing things to destroy Mother Nature is going to put us in the timeout room, which is, I think, what we're in right now. But it can do far worse. I say to people say, oh, the Earth's going to die. No, the Earth is not going to die. The Earth will kill us before we kill it. And I just think that we need to have a conversation about the why of this virus and the how it transpired. And I think it's connected to all these things we care about with our environment, with climate change, with all these things. Just I haven't heard you talk much about this, but I'm just curious as a citizen even, where you stand on this and what you think we need to be. If you don't have to have the answer, just get us thinking about this.
Yeah, so I did write a piece for the Washington Post about the issue that there are particular hotspots where viruses emerge, where the mixing between people, animals that have been displaced from their habitat. China, this area of China is one of them. And it's a very important area that we've seen has generated a number of these viruses, SARS being one of them. So you're absolutely right that there is this change in the relationship between animals, humans, the environment that does lead to the hopping, the host transfer from, in this case, it appears bats to human beings. And that does have to do with encroaching on environment, more detailed and prolonged interaction between people and animals, where the viruses can adapt to a new host and that new host has never seen this virus and can really, really be deadly, as we've seen. The same thing is true of Ebola. It was true of, that's how we got HIV. And so you're absolutely right. We have to rethink our relationship with the environment if we're going to try to minimize these major disasters.
And how do we stop this? In New York City here, the hate crimes against Chinese Americans in the last month or so, it's been, pretty
ridiculous.
Awful.
Yes.
So how do you, as a scientist, as a doctor, explain to people that this is not the Chinese people you need to worry about? As I say, you need to worry about somebody who doesn't do anything for 8 weeks when they're in charge.
Yeah, well, I think that is, prejudice, and it's not, it's stigma. It's not very helpful to keeping us safe, and it's certainly not representative of how this virus started and how it spread.
Well, I look forward to talking to you again. Thank you for coming on, and thank you for the work you've done all those years at the NIH. It was 15, 16 years, something like that.
Thank you.
We appreciate your service to this country. Keep telling the truth. We need it. I don't mind if it's bad, because I can deal with it. And a lot of us can deal with it. The American public doesn't want to be treated like babies. We are adults, and together, we've done this before in our past. We have made this a better country. We've come out of huge adversity. We can do it again, but we need people like you leading the way, telling us the truth. Keep doing that. Thank you, Zeke.
Thank you.
Thank you.
Take care.
Dr. Ezekiel Emanuel, whose podcast is Making the Call, and also on MSNBC on Friday nights, 10 p.m. Eastern and Pacific, where he gets right into it. You get a full hour of this, and I encourage people to listen to it, and also your book. Thank you very much, and thank everybody who listened to this podcast. I know there'll be a lot of comments. I'll pass them on to you, and we'll talk again soon.
Thank you, Mike. Take care.
Thank you, Zeke. Thank you very much. Thank you for listening to this episode of Rumble with Michael Moore. I happen to be Michael Moore, and I'm grateful to all of you for participating. Don't forget to watch our film. I'm the executive producer of it, filmed by Jeff Gibbs, called Planet of the Humans. It is still for free on my YouTube channel. Just go to the Michael Moore YouTube channel. It's just 98 minutes long, and you will see some truths that you are not and have not been told. And we present them not to just scare the shit out of you, but to say, look, we are all good people. Everybody in this movement is good and has good intentions. We need to come together and think about whether or not we're on the right track. If you just dig in and say, yes, it's the right track, and you don't do anything, you just stay there, what if you're wrong? At least if you've had a discussion and you consider multiple tracks that we might be on to save ourselves, this planet, this species, then maybe you have a better chance. Why would you take the risk of only one track? Who puts their eggs all in one basket? That's what we've been doing. That's got to stop. That's got to stop. And to the young people who are listening, bless you. Thank you for yelling at us. Yell more. Civil disobedience. Make your voices heard. I'll stand with you every inch of the way. And I know a lot of people listening to this podcast will too. Leave me your comments here on the podcast page. Send me a voicemail. You can actually send me a voicemail. I listen to all of them. And you do that, I think, on the Anchor platform. I love hearing from people. It helps me to think about things. And you will hear from me very, very soon here. So until then, be well, be good to each other, don't despair, and wash your hands, please. Okay. All right. Love you all. Take care. Talk soon.